Well, right now, the U.S. is averaging twice as many new COVID cases every day as daily vaccinations. Officials still pushing to get more shots in arms as the number of people hospitalized sits at record highs, and intensive care units are trending toward capacity in 19 states.
More than 15,000 National Guard members have now been deployed in all but one state as healthcare systems in many areas face critical staffing shortages amid the surge. Joining us now to discuss, CNN medical analyst Dr. Jonathan Reiner. Dr. Reiner, good to have you back. I'm going to always do my best in the midst of this to be a glass half full guy. And when you look at the data in a place like D.C. and New York, where Omicron hit first, the surge is already tailing off. It's coming down and burning fast like we saw in other places, South Africa. As you look at the data, in your view, has the surge already peaked in some parts of the country?
Well, in D.C., we were among the first to see Omicron. And if you look at daily cases are now clearly beginning to drop in the District of Columbia and in Northern Virginia and Maryland. The problem is that hospitalizations lag several days behind case counts, so our hospitals are still packed. And we are super short on staff, both from the chronic staffing shortages that we've seen over the last few years during the pandemic, even preceding the pandemic, and now exacerbated by staff illness, by staff getting COVID and having to isolate for 10 days. So our hospitals are still under great pressure right now, but I'm very encouraged that case counts are dropping now in this area unmistakably.
That is a positive sign. I'll preface this question by noting the obvious, and that is that I don't believe you are a legal analyst, but you are a health expert. And from that perspective, I'd love to get your reaction to what we heard from the Supreme Court yesterday, blocking the administration's mandate for businesses, large businesses, to impose vaccines and testing, but allowing them for some hospitals that provide Medicare and Medicaid help. I'm curious, did that ruling make sense? From your perspective, and what's your take on it?
No, I mean, I thought that the obvious political leanings of the court were shown in that decision. And I was also struck by the astonishing lack of information as evidenced by some of the questions posed by some of the justices, particularly Justice Thomas, completely misquoting data and misunderstanding how this virus spread. And, the court's decision, which basically said that workplaces, by and large, are not risky places to acquire the virus, the counter to what the court has set up. You can't enter that court unless you are vaccinated and tested. So the court has cloaked themselves in the protections that most workplaces don't have, yet they would withhold that from, millions of workers in the United States. I thought it was a shameful decision.
Ariane DeVoe, our Supreme Court reporter, made that point last hour, that the justices themselves vaccinated. I want to ask you about the administration's testing response here. Senate Democrats have sent a letter to the White House asking why the administration didn't do this more quickly. And I wonder, by the time all these tests get out to people, and granted, it's a big effort, perhaps 1 billion tests being sent, will it be too late to have an effect on the Omicron surge?
Yes. The short answer to that is yes. So first of all, there's no website up and running yet to order tests. This whole business of even paying for tests for people is so layered and cumbersome. Having to get your insurance company to pay for it as to be really unhelpful. This administration placed all of their eggs in vaccination, and the problem is that I don't think at the outset they understood how recalcitrant almost a quarter of the population of this country would be to getting vaccinated. And then when this surge hit, when the new variant hit, we desperately needed rapid tests and we just didn't have it. So yeah, there'll be more rapid tests on the market, more rapid tests available. Hopefully they'll be either free or less expensive, but it's going to come at the end of Omicron.
Yeah. More masks will be sent out as well, but as you said, probably a bit too late.
The Omicron variant continuing to drive some new daily record COVID numbers. Look here, more than 155,000 Americans are hospitalized with COVID-19. That leaves many hospitals short-staffed, and some now relying on National Guard members to help fill the gaps. Let's get some insights and expertise. Dr. Ali Raja is the Executive Vice Chair of the Department of Emergency Medicine at Massachusetts General Hospital. Doctor, grateful for your time today. One of the things we've talked about the last couple of days here in this program is in the big cities where Omicron hit first, some evidence perhaps were peaking and starting to come down. Yours is one of them. These are numbers from the Boston Department of Health. And if you look to the right of the screen, the Omicron surge not as high as it was, perhaps starting to tilt down a little bit, at least when you look at the average. That is potentially hopeful, but you're not seeing it in the emergency room and in the hospital yet. Is that right?
Not yet, John. We have 260 patients right now admitted with COVID to Mass General, and the numbers still look like this. We haven't seen that plateau yet. So unfortunately, while numbers might be plateauing for the city or the state, for the sick patients who end up in the hospital, we haven't seen that yet.
And so I'm from Boston, and so I pick up the Globe every day. I do it online now because of my distance. And I saw some pictures of protests outside the mayor's house the other day about her new vaccine mandate in Boston businesses. How do you, as a public health professional, I don't want to get you too deep into politics, but how do you try to break through with people in the sense that if you look at Omicron, you look at the data, that if you are vaccinated and if you are boosted, you are in so much better shape? That's true throughout once we've had vaccines, but especially with Omicron. And yet, look, this is the fully vaccinated percentage population in the United States. 2 months ago, it was 59%. 1 month ago, it was 61%. Now it's just 63%. It has barely budged up despite all the public data telling you this is the way to help yourself. If you look at the unvaccinated, 2 months ago was 26%, a month ago 23%, now it's 21%. And even among those who are vaccinated, and the government says get a booster, it will protect you against Omicron. 78 million people have received a booster, but that's about 40%. It's fewer than half of those eligible for boosters. How do you break through?
John, I think what we're going up against is that so much of the data is showing that Omicron is less severe than Delta and other variants. But what I try to remind my patients, especially those who come up and say, well, I'm going to have an Omicron party so that we all get Omicron now and just get it over with, is we know that COVID has long-term effects. And we know that we don't know all of them yet, and we know that there are going to be many more long-term. So if you can avoid it, we still need to avoid it. This is not something we should all just try to get over, and that's why we need vaccines and masks.
One of the conversations from the very beginning, when Trump was president, was why isn't there more and better and easier and affordable testing? Are we getting anywhere there now? The administration, the Biden administration, says it is trying now to ramp that up. Democrats today sending an urgent letter to the White House saying you're not doing it fast enough. Where are we?
We're not there yet. John, the fact is that it's great that President Biden is having insurance companies pay for and support people getting their own tests. But right now, getting tests is still exceptionally hard for my patients and just as importantly, for the healthcare staff who are trying to take care of them in the hospital. Even our own nurses and doctors can't find rapid tests to take. And so it's still very much a problem.
Dr. Raja, grateful for your time. We'll continue the conversation. Hopefully it gets better in the days ahead. Grateful to see you today, sir. Thank you.